everyone, welcome to SCube TV. I'm your host Rajni Bharara, and today on the show I have with me a very special guest. She is a cosmetologist, a trichologist, and also a dermatologist. Her name is Dr. Vimala Manne and Dr. Vimala Manne. And today on the show we are going to speak with her about hair problems and skin problems. But before we dive into the topic and we speak with her about the topic, we would like to welcome her to the channel and also to the show. Hello, Dr. Vimala. Welcome to SCube TV.
Thank you for inviting the team of SCube TV, and I'm just eager to answer all your queries about skin and hair.
I'm sure. Okay, so Dr. Vimala, I would, before, I already have introduced you to the audiences, as in that you are a dermatologist, cosmetologist, and also a trichologist. But now I actually would like you to, if you can please introduce yourself to the audiences and talk to them about yourself a bit more.
So I'm actually a dermatologist, did my MBBS graduation from Gandhi Medical College in Hyderabad and MD Dermatology from Usmania Medical College from Hyderabad. But I was trained in Kaya way back in 2007 in Mumbai, and then St. John's, Bangalore in 2008. After I completed training, I was a consultant in Care Hospital, Nampally, and later I worked for 6 years in Oliva Advanced Skin and Hair Laser Clinics, and I was a medical director of Label chain of clinics as well. But of late, I'm now concentrating only on my clinics. So I have two branches, Dr. Vimala Skin, Hair and Laser Centers, one at Medipatnam and one at Raidurg, Shekpet, Gachibowli Main Road. So we do a lot of treatments regarding skin and hair, and all of them are non-surgical. So people don't want surgical procedures for cosmetic purposes most of the time. If they can avoid, they want to avoid. So we have a one-stop solution for all your skin and hair problems.
Great. So all the people in Hyderabad and also nearby, you can go visit Dr. Vimala Manne. I'm really sorry about pronouncing your name wrong twice. So Dr. Vimala Manne. So you can go visit her and you can go visit her branches and solve your problems, all your skin and hair related problems. So Dr. Vimala, now I would directly like to jump to the topic of discussion today. And my very first question to you is, when do we have our skin problems? I mean, what changes does our body go through that we find our skin problems and we go through our skin problems? So if you can please talk about that.
Ideally, when we are born, we are all born with marvelous, remarkable skin. So the thing is, once we start growing up, there are a lot of changes which happen. So the changes can be intrinsic, that is internal innate changes which happen because of the hormones, because of the food intake we have. So there and because of the growing, the physiological changes which happens because of growing older. And extrinsic factors. Extrinsic factors are factors contributing from outside, whether it's the pollution, whether it's the UV light, your lifestyle changes, and so forth and so on, and your addictions and habits, like whether it is your smoking, whether it's lack of exercise, and all these factors. So those are called extrinsic factors. So as we keep aging, there's a lot of interplay between these intrinsic factors or innate things. Especially our genes also contribute the way the skin looks, and how we tend to have a healthy skin or hair. So both contribute equally.
Okay, great. But Dr. Vimala, now my next question to you is, when we are a kid, so like you mentioned that we really have great skin, great hair. So is it possible for us to have the exact same skin as we were having when we were a kid? So is it possible with the growing years, if we take good care of our skin and good care of our hair, so we can still have that glowing skin and that nourishing skin as we used to have earlier?
It depends on how motivated you are to take care of your skin. Basically, if you had a healthy lifestyle from day one, as a parent, if the child was nurtured with very good food, exercise, sleeping early, and the kind of daily care regime which has to be taken care of by the mother towards a child. And once the child enters the adolescent stage, they have to fight a lot with the hormones as well, because the hormones increase the sebaceous gland activity, and the skin becomes much more oily, scalp becomes much more oily. So at that teenage or adolescent age, they're prone to dandruff, acne, and so many other problems which they have to take care of. And then once you cross that barrier of a young adult and enter into into a middle-age group, the oil glands, start decreasing. Again, there's a change of hormones because of your pregnancy, lactation, so many things which go on, and all these play a role. And unless you actually know how to take care of your skin at each stage, because it is different because of the internal factors which are changing, and you have to get over those with your good lifestyle and the food habits, your exercise, and your sleep patterns. So as I said, 50% depends on your own self. How do you take care so that you can remain as young as possible, even in your 60s or age.
Okay, that's great then. I mean, also, if, I would again like to request people that if you have any problem regarding your skin or hair, you can go visit Dr. Vimala Manne's clinic. She's having 2 branches, like she mentioned. So we are going to also put the address and everything in the description box. And we are also going to mention her contact details in the description box. So you can go check it out. But with that, Doctor, I would also like to know from you that, when we talk about skin problems, especially, so what is that one particular thing internally that we need to take care of in terms of getting a better skin?
So as I said, the internal factors are not under our own jurisdiction. So basically, the internal factors are your genes and your hormones, or the mutations which are going in this hormonal milieu which happens. But these can actually be, in fact, instead of getting accelerated towards the aging factor, we can actually decrease these things, internal things which are actually increasing our aging, by a very good healthy eating habits. The most important for good skin is colored fruits and vegetables. Like, you have to take a lot of carotene rich and vitamin A rich foods. So ideally, you have to take red, yellow, orange colored fruits and vegetables daily. So this is an antioxidant rich food, because our skin day in and day out is exposed to so many environmental pollutants and chemicals, and even the cosmetics nowadays. People use too many cosmetics. So all these chemicals have a detrimental effect on the skin. So to prevent the aging which is happening because of the UV light, which is called photoaging. So ultraviolet light plays a major role in aging. So that is the reason why darker skin people age less, and fairer skin people age more. So they get wrinkles at a very younger age. Though we Indians and Asians like fairer skin, but other continents, nowhere fairness is never equivalent to beauty. Beauty is uniformity, symmetry, and proportion. Unlike we Indians who like fair skin and they think fair skin is beautiful, which is not true. Because fair skin cannot tolerate the changes which happen because of ultraviolet light, and a fairer skin person ages rapidly. So using a good sunscreen, wearing a cap, hat, or umbrella to prevent this UV light exposure, especially if you're a person who works outdoors or who travels a lot. You have to take care of your skin and eat a lot of antioxidant rich foods, as I said, colored fruits and vegetables, balanced diet, and protein rich food. So iron rich, protein rich, and antioxidant rich food is what we use. But unfortunately, we tend to prefer easy to cook, those which are laden with preservatives and calories. We just pick up from the stores, and then 2 minutes curries are done, and 2 minutes noodles are done, and then we want to munch in something and just rush to work. That kind of food definitely makes our skin much more aged. So that at least you can take care of by eating healthy, and an exercise plays a very important role again, because obesity itself causes a metabolic syndrome, like you tend to get heart disease and all other conditions, which again causes aging of the skin much more rapidly. So basically, good exercise, wherein you sweat a lot from your skin, so that the skin is always fresh and the pores are unclogged because of sweat. So exercise, avoiding junk food, eating on time, sleeping on time, and having a healthy meal is the mantra for very good skin.
Okay, great. Those are some great tips. But with this, also, I would like to know from you and also for the audiences too, when we talk about eating healthy and getting, colored vegetables in our plate. So let's, because of the sedentary lifestyle and because of the busy lifestyle, people are normally not having that routine so that they can take care of everything about their exercise, their food and the proteins, vitamins, everything. So if they're not able to get all the vitamins and proteins necessary for a healthy skin or good hair, so what can they expect from their dermatologist? And how can a dermatologist help them?
See, ideally, depending on your weight and height, your BMI, there is always a right way to eat and then balance it with exercise. If your body mass index, your weight is not proper according to your height, and then the problem definitely arises. So without exercise and eating right, you can't get away. There's no easy way. So the dermatologist can actually, depending on your skin and hair, write all your vitamin tests, analyze them, and then tell them what is the right value for your own height and weight, the values of vitamins required. We can give supplements for a short period of time, but supplements are still supplements. They cannot replace organic food. But definitely, if the damage is already being done, there are so many aesthetic procedures which can restore the skin to a younger and youthful looking skin, or thicker and longer hair. But the thing is, if you have to maintain them, again, good diet and lifestyle exercise are essential. So a holistic remedy is the treatment suggested by dermatologists, like whether it's for skin, we do chemical peels, or we do Q-switch laser toning. There's so many varieties of treatments for brightening up the skin. And then for your wrinkles, we do have Botox, we do have fillers, thread lifts, HIFU. There's so many procedures for anti-aging as well. So we can actually help you do these procedures and look 5 years younger. But if you have to maintain that again, because aging is a constant process and you can't just stop aging.
Yeah.
So it will definitely happen. You can just slow or regress its progress. So that's the reason we give a holistic remedy and a good diet sheet we give you, and your exercise plans we suggest, and do the procedures. But it has to be your contribution as well. It cannot be just the dermatologist's contribution.
Yeah, true. Absolutely. So now, speaking of procedures and speaking of fillers, now in this episode, I also would like to know from you that, when, let's suppose when we need to get fillers in our face or in our skin. So, what is that process, and how many steps does that process have? And then how do we need to take care of it if we go through those, let's say surgery?
Okay. First, there's a misconception that the aging will start only once you're above 40, above 50 or whatever.
Okay.
Because Indians, unfortunately, right from 20s, the aging starts with the tear trough. So we have a very, the under eye circles, the dark circles, and the depression around the eye in the form of where the tears flow, that kind of a thing, a depression. That's called a tear trough, which happens right from 20 years of age. So unfortunately, we Indians tend to age with the tear trough initially. So even at 20, if you have a tear trough, if you don't correct that with a filler, then what happens is you'll have a very tired look. So even if you slept well and you're healthy, people would ask you, are you tired? Are you not feeling well? Or are there any problems at home? And they'll just get baffled by it. That why are they asking me that? Because I'm perfect and fine. Because of that tear trough. So if the fat is lost below the eye and there's a depression there, we just fill in that area. And we just, like suppose, even if you look at my face, you may think I'm for a 42-year-old, I may be looking young right now. But ideally, that's thank you for the compliment. But I am 42 because there's 16 years of experience as a dermatologist.
So that. We have the example right there, people. So if you're going through any of your skin problems, just go to Dr. Vimala. She's going to solve all your problems. Yeah.
So if you just look at me, you may think 42, I'm looking young for 42. But if I actually do a procedure and I actually pull up this area, so what happens? My tear trough disappears, my fold here, which is called the nasolabial fold, disappears. And then the jawline also, I pull up like this. So this is what I can do with a filler or a thread lift. And you can see this side and this side. This guy definitely is 5 years younger than this. You can agree with me. I look much younger. Now this could be a younger version of me if I get it done. But unfortunately, I have to go to some other dermatologist if I have to get it done. But you can always come to me. So that is what fillers and thread lifts do. And you do a single session, they last for a year. So since aging is a continuous process, obviously after a year you have to get it done again. But one sitting, single sitting, the result will last for a year.
Okay. So is there a particular age that,
that's what I said. Above 18, anybody can get it done if they have an indication. So if they have a deep nasolabial fold, or if they have the tear trough, then some people use a lot of facial expressions with the people in the media or the actors and so for them also, it's very important. They use all their muscles. And when you're using your muscles too much, definitely you will have a faster wrinkling. Like people who smile a lot, they'll have their crow's feet. People who frown a lot and they're usually annoyed, they'll have these lines here on the forehead. And people who have this expression always, they'll have these forehead lines. So all this, when we are actually giving the expressions, you'll have this. But what happens once you start aging, even if you don't put any expression, the lines on the forehead or the lines near the eyes, which are called crow's feet, or the frown lines, they will appear even without putting any expression. So these are called static lines. So even before the static lines appear, we should start treating with Botox actually. So folds are treated with fillers, and there's volume loss which happens because as we keep aging, the fat near the cheek, the fat here, all starts descending because of gravity down. So when we are really young, there's near really good apple fat here, and it starts going down. And once the fat increases here, this is the fold which increases.
Okay.
So for that, we give fillers. For lines, as I said, when we are using expressions, we relax the muscles with Botox, botulinum, that is. So that relaxes the muscle. So it doesn't paralyze the muscles. It doesn't cause any side effects. There's a lot of misconceptions regarding these injections. But done by a trained, certified dermatologist, experienced dermatologist, hardly any side effects. And it's not even painful procedure. And people sitting, 6 months it will last, and every 6 months you get come and get your Botox, botulinum toxin, botulinum injections, and your fillers once in a year.
Okay. But Dr. Vimala, also, a lot of people say that Botox is not fillers and fillers is not Botox. So when we say
both are completely different because Botox is something which we inject, and it, for the time being, it just relaxes the muscles. Because when you're using certain kind of muscles, we are contracting. Okay, so when I'm closing my eyes tightly, I'm contracting the muscles of the eyes, and then the lines appear here. Okay, when I'm doing this, the forehead lines. So you're contracting that muscle and the lines are happening. And I'm trying to relax the muscle. So when I inject it and relax the muscles, even when I do this, the lines will not be so prominent. And an inexperienced person who does this, they give a very plastic look. So even if you want to try to put an expression, they can't. So they look more, there was a time when there was a big hype about these plastic faces or model looking like faces, because of too much of Botox and all. So you go to a trained dermatologist and a certified dermatologist who's experienced, they will never do such kind of job. So these are all done by untrained so-called aestheticians or beauticians or cosmetologists who are not actually done their medical education, whether it's regarding dermatology or whatever. So there are a lot of quacks there doing these procedures, and then people getting wrong things that these are dangerous or these have side effects.
Which was actually going to be my next question, because we have seen a lot of models and also actresses who have undergone the surgery and have done Botox in their faces and have gone terribly wrong. So if I ask you, is there a possibility of, if normal people go for a Botox or fillers, can that also go wrong? Should you be prepared for it if it goes wrong?
See, Botox and fillers done, that's what I'm saying. A trained dermatologist or a certified dermatologist, experienced dermatologist does. Till now, nothing has gone wrong. So whatever goes wrong is when people are untrained, unprepared, and they do it. So if you're doing, it's like any doctor. If you go to a heart doctor and he's not trained, and obviously he doesn't put a stent properly, and there's some rupture of some aorta or some blood vessel, he's going to bleed to death on the table only. So whichever profession it is, whether it's a dermatologist or whether it is a cardiologist or whatever, they have to have that skills, the experience, and the expertise. So you have to trust your skin, do your homework, not just the prices. Because many people tend to look at the prices, okay, this is reasonable, they're charging less, let me go and get it done. But then if you can't entrust your heart to a good cardiologist, how many people you require before you go for a cardiac surgery? And you forget that skin is a major, largest organ of the body.
Yeah.
Okay, so when you are investing in your skin, you should invest properly. So you have to find out a good dermatologist and invest. That's it. So the side effects are not there if it is done in a right way. Otherwise, everything will have a side effect. If you take a crocin tablet, that is paracetamol, if you read about the side effects, acute liver failure will be there. But a newborn baby, if he has fever, what we give? We give a crocin syrup, we give paracetamol syrup. But how many percentage will have acute liver failure? 1 in 1 million. So same thing is with Botox or fillers. You know that 1 in 1 million will have bad luck. Who is with a bad person who's injecting it? Not trained person injecting.
Yeah, we can look at the Kardashians over here. Yeah. So, Dr. Vimala, also I would like to know from you that when a person goes through a surgery or fillers and Botox. So after that, you said it lasts up to 1 year. So in between that year, how can they take care of themselves when at their home?
So we give some anti-aging creams, a good sunscreen, a good face wash, and a good moisturizer. These are minimum. A good sunscreen, which has to be religiously applied every 3 hours if you're outdoors.
Is there something that they should avoid in particular?
Excessive exposure to UV light, pollution, and junk food. So obesity is one thing which is a strict no-no. So you have to exercise and eat right. So what are the antioxidant-rich foods, iron and protein-rich foods, which can actually help in as an anti-aging regime? That kind of a diet and lifestyle they have to follow. So we actually give them creams, the night creams, which contain various anti-aging medicines in it. So every day, night they have to apply. Morning, we give them a sunscreen to use religiously, good face wash and a moisturizer, a good diet and exercise plan. These are the major things which they have to do. And stress again causes aging signs to be very fast, and we know whether it's physical stress or mental stress. So we tell them to, yes, definitely people who are really stressed up, we suggest them to go for meditation. And if they really require psychiatric help also, I do suggest them.
Okay. So now I would also like to know from you about retinol. So, it is said that retinol, people should use retinol after they are 30. So is it true?
Yes, topical retinoids are very good anti-aging creams, but then each skin is different. So what kind of retinoid we have to select? Because there's so many: retinoldehyde, retinol, retinol palmitate. Retinol palmitate is just a moisturizer; it doesn't work as an this thing. But people see first part of it and think it is and many expensive creams are there which actually have this kind of composition. There actually 2 retinoids are not there in it, but they're publicizing it as anti-aging and charging a lot for those creams, on the counter creams. So these are non-medicated creams basically. So to get the act right, you will have to go to a dermatologist depending on your skin, because dry skin cannot tolerate high concentration of retinoids at all. And oily skin can actually take it, but a combination skin, you may have to have some moderate strength of retinoid. Okay. So for your skin, which is the tailor-made prescription, always your dermatologist can suggest. So definitely retinoids help. Then what kind of retinoid? You will have to go to a dermatologist.
Okay. But in the age of social media, when the experts, social media influencers, so when they are promoting the brands and they are advertising so much and they are asking, the normal public to use this and that and that and that in their faces. So, retinol is one of those products. So, should women or girls in their 20s should also use it, or should they avoid it until they are 30?
No, it's not about the age at all. That's what I'm saying. A 20-year-old, if she's aging very rapidly, she may require at the age of 20. So nothing matters. What is your skin health to that particular age? Is a 20-year-old girl is actually having a 20-year aged skin or not? Or is she having a 30-year aged skin, though she's 20 years? So chronological age means your true age is different, but the age your skin is having right now may be different. Okay. So sometimes a person who's in 30s, her skin may be looking great, and the actual age you will think it's only 20s. Okay, so like that. So it doesn't depend on the number at all. It depends what is the age of the skin right now. So at 20, if she's having an aging skin, definitely she has to use retinoids. But all these will have its own pros and cons. So that is what I'm telling you. Some people have excessive dryness. Some people will have irritation, stinging sensation with retinol. Some people tend to tan a lot with retinol. So selecting the right product for the right skin type.
Okay.
Very important.
Okay, got it. So with this also, I would like to know from you about hair also. So when there's a lot of loss of hair, so what should be our first step? I mean, and also at what stage should we go for hair transplant?
See, ideally, again, as I said, again, age is not a matter, because hair loss now we are seeing from very young age children to older age. Previously, there was a norm. 10 years before when I started, or 15 years before, when I initially started my practice, it's almost now 18 now, though I'm also getting confused with my age now. So 18 years back when I started my practice, actually, we used to get only people who are above 40s who used to complain of hair loss. We never had patients who at 20s coming for hair loss. But off late, we see patients of 20 and even 10-year-old complaining of severe hair loss, and the mother is getting panicking, getting a child. So things have gone wrong completely somewhere, whether it's the genes, whether it's the pollution, environmental factors, or the quality of food we are getting, the diet, lifestyle changes which have happened. So some mistakes are of us, of society as a whole, and there's a lot of change in the environment which has happened. So hair loss is coming at a very young age. So that is the major problem. So whether it's our diet, lack of exercise, sleep, we are stressed a lot, we try to do multitasking, and we don't take care of our hair properly. So, and you should understand, for body, hair is a useless organ. So whatever we eat, it goes to all organs of the body. Anything remains goes to skin and lasts to the hair. So if you're not eating properly, then the first thing which gets affected is hair, because the body will not send anything to the hair and it will just keep it for the important organs of the body. So that's why people who diet or after delivery and all, after 3 months is severe hair loss, because all the vitamins and all are taken care by all other organs, and it goes to the hair. So hair is maximum affected when you do this fat diets and fast rapid weight loss programs and all with the GM motor diet, or whether it's your diet the fat diet which they do with eating only fats. Or only proteins. Some people eat only protein diet, no carbs, nothing and all. So they all will have severe hair loss. You will lose weight, but then you will have to compromise on your hair.
Okay. But then at what stage should we go for a hair transplant when there's a lot of hair loss?
Hair transplant is one thing when it is very severe or your hairline has receded a lot. Because usually when the hair is gone in the center, you may not look older. But if the hairline has gone back, so people who look at you from the front or a side profile, they feel that you're 10 years older than your actual age. So a 20-year-old, if he has baldness, but the two sides have gone a lot, so he will look like a 30-year-old. So for such people, it's very important, irrespective of the age, to get a proper hairline done. Irrespective of transplantation, where the hair has thinned out. Okay, for women, it's usually the partition widening. That's called female pattern hair loss, and then slowly in between the hair, you can see the scalp visible. So for those things, we do something called as PRP, platelet-rich plasma treatment, wherein we draw the patient's blood, separate the growth factors, and we inject them into the scalp. So this works very well. And usually we do like monthly once for a couple of sessions, and once the hair growth is good, they can come for maintenance once in 3 months or 6 months. PRP works very well for men also for initial stage of baldness in grade 2, grade 3 initially. But once they enter grade 5 and grade 6, where the center is completely bald and they have a lot of hair behind, a lot of body hair, then that's when they go for hair transplantation. But irrespective whether you go for PRP or hair transplantation, medical management is very important. So there are some solutions which we tell them to apply at night. The good shampoos we suggest depending on whether they have dandruff or not. So, and we do all the vitamin tests and the hormonal tests, because sometimes it's the thyroid which is causing the problem. Sometimes in women it's polycystic ovarian syndrome. So which causes severe thinning of hair, then facial hair, a lot of acne, lower face acne, obesity. and blackness and thickness of neck, underarms, inner thighs. These are the things women nowadays experience because of hormonal imbalance. So in such conditions also, apart from doing this PRP, which gives wonderful results, and no side effects because it's from your own blood. So we are not taking out the growth factors somewhere external. So what is more pure and safe than your own blood? So doing this and properly analyzing the cause, doing your hormonal assays and vitamin assays, we will do the treatment.
Okay, great. Thank you so much, Dr. Vimala, for coming to SCube TV and speaking with us. It was so lovely chatting with you. It was such an informative session, and you actually educated us a lot in about different topics. So thank you again for taking out time and doing the show.
Thank you so much, and wonderful anchoring. I really enjoyed it. And thank you, SCube TV viewers. I hope I was really of some help and advice. If you have any issues regarding skin and hair, you're more than welcome to visit our Dr. Vimala Skin Hair Laser Centers at Medipatnam, Shakepet, Gachibowli branches. Thank you.
Thank you again. All right, guys, that's it from SCube TV. Keep on watching and do subscribe to the channel.